She's the pushy broad from the Bronx, New York. Follow her voice, a straight dog is nice. She's a pushy broad from the Bronx, oh yeah. Don't be surprised if you wanna listen twice. Make decisions, find the right choice. Know yourself better, find your own voice. It's okay if you need help today, cause everybody needs a little push. From the pushy broad from the Bronx, New York.
Welcome, Transformation Talk Network listeners. My name is Ellen Stewart, and I am the pushy broad from the Bronx. Welcome to my show, Recovery Recharged, where we share advice and support from experts in addiction and recovery. The pushy broad is very privileged to have this person on our show today who knows so much about the field of addiction and recovery, in addition to so many other things. But one of the things that we're going to talk about today that I know you're going to be interested in is, does genetics play a role in addiction? Let me tell you about the expert that I have brought on today. Dr. Fredric Abramson is an accomplished individual, even though he says that when he was in high school, he was told he would never go to college. Turns out their predictions were wrong, because he has degrees from 5 universities, including his PhD from the University of Michigan in human genetics and population planning, his Master's of Management as a Sloan Fellow from MIT, and his law degree from American University. Fredric is also an early software pioneer, learning programming in 1965. He wrote the first big data study in healthcare in the late 1960s, and also wrote the first healthcare AI program in the mid-70s to identify the risk of a person getting infected on admission to a hospital. Dr. Abramson has taught in different universities, including 25 years at Johns Hopkins, where he teaches the business and management courses to the graduate students in biotechnology. Starting in the late 90s, Dr. Abramson has focused his energies on creating a field that he calls wellness genetics. This approach looks at how genes impact our everyday life instead of looking at how genes relate to disease, death, and dying. I want to talk to him about this later, but he founded something called Golden Thread Technology, using DNA data combined with data analytics to identify the differential risks of injuries to kids in sports and adult athletes. I cannot wait to have him join me this morning to talk about this very interesting and poignant topic. The Pushy Broad from the Bronx and Recovery Recharge welcomes my esteemed guest, Dr. Fredric Abramson. Good morning, Doc. How you doing?
Thank you. I am honored to be here, Ellen, and happy to contribute whatever insights and thoughts I can for your audience, because it's a challenging area in a person's life, and it deserves a lot of interesting and valuable attention.
There are so many things that we have learned over the years, and so many studies published by so many reputable universities, including all of those from the American Society of Addiction Medicine, about what family history is like in the realm of addiction. So let's get right down to it. Does genetics play a role in addiction?
Of course, genetics plays a role in addiction. The key element for me to share is not to look at a direct role, that gene A means addiction, gene B means no addiction. The human genome is the most complex system on Earth. And as a complex system, it interacts with the environment that we create, basically to keep us alive, despite our best attempt to screw it up. And so,
I get it. So what you're saying to me is, if my mother has some genes that would indicate addiction, it doesn't necessarily mean that she's going to pass them down to me. Is that what you're saying?
I would add two pieces to that. The fact that one parent has a gene doesn't mean that you'll end up with that gene, because it's basically a 50-50 shot, because we have two copies of everything. But the other thing is that whether or not you have a gene that relates to addiction doesn't mean that you will develop the trait or the behavior of addiction. And that's the second part that we can talk more about. How whether a gene means it's automatically fated to have some outcome.
Are there some predictors to that effect, though, as to the likelihood of how it will occur or if it will occur?
Well, I think in the world for addiction itself, I think there's not a whole lot known precisely about the genetics of addiction. But if you take the broader picture, for example, there's a gene variant that relates to anxiety. Anxiety relates to addiction, because addiction is a coping mechanism for anxiety. So, yeah, there are, I would use the word mild predictors. But I can give an example of a gene variant that's really powerful that is impacted by the environment, because it's the environment that we can control. But I'll let you follow up with where
No, please give us an example. Go ahead. I'm interested.
Okay, well, I'll give two examples of two gene variants where the environment plays a crucial role. One gene variant is a fun one for perfect pitch in music. Turns out, if you have the gene for perfect pitch, you have to be exposed to music in the first 7-8 years of life. Otherwise, you never develop the trait of perfect pitch. And that's where the role of epigenetics comes in, a term that everyone likes using. Okay.
Explain that. Well, while we're here, explain epigenetics for those of us who are not in the field like you are.
Well, I think I'll make it really easy. Think of a gene as an automobile engine. When it's off, it's off. When it's on, the speed of the engine determines what it can do. Well, the gene's the same way. When it's off, it doesn't do anything. When it's on, the activity level, the speed of the gene, impacts what it does. And so epigenetics controls the speed of activity, or the activity level of a gene.
And I don't know if this is even an accurate question, but if you're saying that that is controlled when the gene is technically turned on, can it be fueled?
Yes,
it can.
It can be, because
okay.
Well, and that's a very complex mechanism, and they're just working that out.
So it can be fueled, and that's something that we're working on. And I guess the reverse of that is that it can be diminished as well.
Yes, it could be just like you take your foot off the gas pedal, the engine
Reduced.
working.
Okay.
That's it's a good metaphor to use, because the gas pedal is what can, and the ignition key is what determines what the engine does. We can control the gas pedal and the ignition key, but unfortunately, not a lot is known yet about what precisely moves the gene levels up and down.
So to go back to where we are in terms of how genetics plays a role in addiction, if I have a family history of addiction, you're saying that I'm not necessarily doomed to become addicted. Is that correct?
Yes, because first of all, a lot of it could be behavioral, that you simply learn from your environment. This is true of a lot of eating issues, that people learn to eat certain foods, and that impacts their weight, obesity, or even on the lower end. But the other thing about understanding the environment, I want to give the example of Huntington's disease, which is a single gene disorder called an autosomal dominant. And its onset is on the late 40s, early 50s. It's a neurologic disorder. And when it happens, your path out of life is pretty well determined to go in about 5 or 7 years. And for those who like interesting things, Woody Guthrie, the folk singer, had Huntington's disease. Now, in traditional genetics, if I had an identical twin and I'm diagnosed on Thursday, he'd be diagnosed on Friday because we're identical. Now, Ruth Abramson, my original wife, is also a geneticist, and she studied identical twins for Huntington's and discovered the age of onset could vary up to 8 years in identical twins.
Wow.
Right. Well, duh. That's the environment. So the
Yes.
environment is not just this little thing that we have to tolerate. It says that with focus and more insight into what goes on behind the scenes, the ability to impact the genetic activity that has an impact on our life can be impacted significantly by the environment, which is what we can control.
That's really interesting, really, really interesting situation. The American Society of Addiction Medicine. And I spend lots of times reading the latest medical journals because my work as a recovery coach dictates that I know what's going on and can explain it not only to myself, who's got 38 years in recovery, but what I do for my show, Recovery Recharged, and what I do for my clients always talks about the fact that addiction is predicated on many factors, hereditary situations, genetic situations, environmental situations, as you said, circumstantial situations, where were you raised, who are you with, and also economic factors as well, and also not only psychological factors and mental health factors, but ethnicity as well. So all of these things play a component. So what you're saying to me in tying this together is that they can have direct correlation to gene manipulation in some way, or is that what you're saying to me?
I wouldn't use the word gene manipulation because people would interpret that as actually changing the structure of the genome.
I see.
But I think it means that if you know that there's a gene that implicates you in some addictive behavior, you may be able to change activity. Now, one of the things that we can look at is, and not much has been known, how does the general issue of our dietary nutrition and supplements relate to this? For what it's worth, I have a US patent that covers matching the ingredients of foods and supplements to your DNA to lower the risk of disease and to improve well-being. Well, if you take addictive behavior, let's take alcohol. Not drinking alcohol, the substance alcohol, isn't metabolized the same way by everybody. So the question is, how does your body metabolize alcohol? If you know that, when they, in some way in the future of testing that, you can then determine how to modify and adjust what you're putting in as inputs, other than simply paying attention to whether you're dizzy or not. I'm not oversimplifying it, but you understand where I'm going.
Yes, it's a reprogramming of sorts, isn't it?
It's a reprogramming, and your word wellness genetics is about helping us reprogram how we live every day without worrying about disease. Because if we're focused on everyday life, that's what we can control.
And I know you're on a path to living another 100 years, aren't you?
Well, for what it's worth for your listeners, I am 82, and you can make your own determination.
There you go. Okay. All right. So let's move on a little bit because there's some other things I want to ask you along this line. It's fascinating. I could probably talk to you for 4 hours, but we don't have that time. So how can I reduce my risk of addiction if I have a genetic predisposition? What can I do?
if it's determined that you have a genetic risk factor for addiction, the first thing would be to understand the role of that gene in addiction and whether, in fact, the epigenetics issue plays a role. Again, like the gene for perfect pitch. Once you have perfect pitch beyond the age of 8, there's not much you're going to do genetically or in your environment to lower the activity of that gene. However, if you have that gene and you have the trait, you're more likely to be a professional musician than anybody else. So the outcome is it does determine your life course. So in the case of addiction, if we're aware of the genetic factors, what could impact the activity of that gene, and what behaviors can we engage in that kind of say, I won't use or override it, but move that gene to the side as an impact on our life.
I understand. It's putting addiction in remission, therefore putting the gene in almost a dormant situation.
Yeah.
I see. Okay.
And if it's still active, understanding that and then finding other ways to adjust your behavior to take control of it, because that's like the Huntington's gene. You can control your environment. And, it may be something as simple as deciding what things you buy at the store. What you engage in when you're eating foods or socially. I don't want to pretend to dive into your area. That a whole lot more than I do. But it's the environment that we have the ability to control. The gene is simply there. And it's not fated that gene X means Y is determined it will happen. We can control the environment to have an impact on what happens.
This is a very important thing, and I need our listeners to completely understand that. All right. Would you be kind enough to repeat what you said? Because understanding in recovery means that we are not fated and doomed to be active addicts and alcoholics. Is that what we're talking about? So would you mind saying that again, just for the impact value? It's really important for our listeners to hear.
Even if you have a gene that determines a higher risk of addiction, you can adjust your environment in many different ways to lower the potential impact of that gene. You can change what you decide to put in your body in the way of foods or even drinks. And I use drink in the broad sense, not just in terms of alcohol. You can determine what social settings you want to be in. If you go to a social setting where everybody's drinking, you're more likely to be joining into the drinking. But that's a choice that you can make consciously to say, that's not the social setting I want to be in, given I have this gene that's firing up saying, yeah, go ahead and do the drinking. So we can control the situation. We can control what we put in our body. We can control how much sleep we get, or how much, just all the things in our life that can have a positive effect on reducing the, I'll use the word susceptibility to the abusive, the addictive substance.
Fantastic. That's really a positive indication. And that's why we do the recovery work we do, because we do actually know that even though the gene is there, it is not going to go away. It's not going to wither and die, but we can put our gene activity in remission and in a dormant state, which will help us, especially in form of recovery, with our cravings, with our feelings of wanting to do something that is detrimental to our health. And that's the most important thing. We do have some control. Yes.
And let me add just one thing. We don't necessarily make the gene dormant. What we do is we make it irrelevant to what we decide to do in our life.
Okay. All right. That's great. Irrelevancy. That sounds wonderful.
And the other thing I want to add is, from my experience in both the area of alcohol, but also in weight loss and other health areas, is good to move away from blame and self-guilt, because we live in a world in which we're fond of telling people why they're bad because of some outcome or behavior. Genetics doesn't have that kind of role. If it's there, it's there. If it's not, it's not. But the key understanding for what wellness genetics is in their discussion, we have control over what we do. If we make choices that make us feel better in the absence of the addictive thing, we'll do better.
All right. So some really quick questions. Does my family history, the family history, play a role in my genetics and in addiction and its recovery?
Totally. The family history has two pieces in it. Obviously, the genetics, duh. But the other is the lifestyle and the behavior of, you're born into a situation. What's your environment in your family? Sometimes you have parents who are gone early. We have single parents who have to raise a child that they're under different pressures. So the family environment, the environment, particularly in childhood through the first dozen years of life, has a huge impact on subsequent behavior. And part of the challenge is to understand whether our behaviors as an adult relate to something we learned when we were 4 years old, or is something that's part of our genome. And that's why wellness genetics is a term I coined, because, and I use this as a model, because if it's genetic, you have one set of decisions to make. If it's learned, you have a different set. And if I can give one quick example, there's a gene for being shy. If you're
Really?
genetically shy,
That's not my gene. I don't have that gene.
there you go. Well, most people in New York and Philly don't. But
There you go.
but if you're genetically shy and you learn that, it doesn't mean you shut yourself into a room, never talking to people. You say, now that I know that, here's how I can go out and interact with people in a different way, so I don't have my anxiety rising through the roof that causes me to go panic.
I see. All right. So then there's one big question that we always want to know, especially with all of the pharmacogenetic testing that's going on out there. Can medications be tailored to my genes to help with addiction recovery?
At the moment, there's not much known about that in terms of the pharmacogenetics or pharmaceuticals. Ultimately, the answer is going to be yes, because that's part of what I talk about in the patent.
Sure.
You have control over what you put in your body and what the composition is chemically and how it matches our genes. And if we understand that mechanism, we can make choices that are a lot better for us.
So really understanding genetics can really help me with my recovery, yes?
It can, particularly if we set aside disease genes, since that's the stuff that the medical world wants to talk about. But the rest of the genome, use it because it's part of who we are every day. And if you know who we are genetically, you make smarter choices about your everyday life.
So if someone is interested in what you're talking about and wants to get genetic testing to find out these things, how do they go about it?
Well, Ellen, at the moment, there's not a lot being done. That's why I'm pioneering this area, and I'm working with life coaches to create a model where the people can do exactly what I'm hearing you say. Get a genetic test and look at some of the genetic inputs that impact things like your behavior when it comes to what you put in your body. So it's a field that's new and it's emerging, but it's still in its embryonic state.
Well, I'm hoping that you're around another 100 years to help pioneer this, because we desperately need this, and we desperately need this from people like you. All right, we only have about another 30 seconds, unfortunately. But number one, I want to invite you to be a a collaborator with me on my Recovery Recharge show, and I want to have you back from time to time, letting us know how things are going and to give us your very insightful scientific discoveries and, of course, information on genetics. So leave us with your message. What do you want everybody to know today?
Nothing is fated. The genome is a blueprint, and it tells us what our potentials are. And the environment is the thing we control. And what I tell people is you have a genetic map and you can choose to drive on your genes the way you want. That's the environment.
Thank you so much, Dr. Fredric Abramson. This is Ellen Stewart, the Pushy Broad from the Bronx. Thank you for listening. We'll see you next time. This is Ellen Stewart, the Pushy Broad from the Bronx, saying thanks for listening. And remember, everybody needs a little push.
From the pushy broad from the Bronx, New